Okay, so many people are afraid to move when they have an episode of back pain. And it's understandable, certain movements can be uncomfortable and that can be different for everyone. But it's well established that getting back to normal movement and normal daily activity as soon as possible after an episode of back pain is associated with a better and with a faster recovery. It can be difficult to figure out exactly how to do that, so your physiotherapist can help you with that. Similarly, with exercise, including weight training, it has been proven time and time again to be the best treatment actually for both acute and chronic low back pain. So do not avoid exercise after you've hurt your back. If you're not able to do anything and you're not sure how to get back into exercise though, see your physiotherapist and we can help you figure out a plan to get moving and exercising again. So it's tempting to think if you've had lower back pain for a while that a scan will tell you what's wrong. Unfortunately, that's usually not the case. There is a large and growing body of research that shows that not only do results of scans correlate very poorly with symptoms in people with low back pain, but also that many people without low back pain have changes on scans and x-rays that do not cause any symptoms at all. So for this reason and for more, imaging alone is not usually enough to tell us what's wrong with someone's back. Of course, this doesn't mean that all scans are irrelevant. Sometimes we do need to image lower backs under certain conditions, and we will do a post on that later in the week. So stay tuned for that. But they're usually not necessary except in certain circumstances. And there is actually evidence that they can be harmful in some cases. So scans are not usually the answer. Okay, so pain is weird. It's not always proportional to the amount of damage, particularly with back pain. So we know this because we see people with completely normal scans who have lots and lots of pain. And we also see people who have lots of changes on scans, disc bulges, arthritis, all sorts of things, and they have no symptoms at all. So we can think of pain a little bit like our body's protective system or an alarm system. And sometimes that protective system can overdo the response to an injury. And we can get more pain that's just not proportional to the amount of damage that we have. So your physiotherapist can help you to determine which types of pain you can work through and which types of symptoms you should look to modify to get you back moving.